Okay, good afternoon, everyone. Thank you for being here. So now we're going to start with our next session on public health. So I will now pass the floor to St. Luke's College of Medicine Planetary and Global Health Program, Dr. Jake Cortez, to start and moderate the session. Ayun po.
Hi, thank you so much, Liana. Good afternoon, everyone, and thank you so much for joining us. I am Dr. Jake Brian Cortez, one of the research fellows from St. Luke's Planetary and Global Health Program. And with me is also another research fellow of ours, Dr. Pao Tiangco. Okay, and together we will be moderating today's session. So to begin with, we'll be having a small lecturette from our inaugural director, Dr. Renzo Guinto, one of the pioneers, if not the pioneer of planetary and global health here in the Philippines, joining us from abroad. Hi, Dr. Renzo, can you hear us?
Hello, magandang umaga mula sa Berlin. Good morning, magandang hapon dyan. Thank you. Can you hear me?
Could be a little louder, Doc.
Okay. And you know, Jake, that I have a very loud voice. So now I'm literally shouting here in the hotel.
Okay, okay, I see.
Magandang,
there.
Magandang umaga. Maybe you can adjust your volume, your speaker's volume, because right now I'm really shouting.
Okay, Doc. Yeah, no worries. Better na po, Doc. Better na. And we can see on screen.
Good. Thank you. Good morning from Berlin.
Okay, so Dr. Renzo, you might want to start sharing your slides and we can begin with your lecture.
Great. Maraming salamat po sa pagkakataong ito, Code NGO. Liana, nice to see you again. I wish I can join you in person. Request pala, no? I think naririnig yung sarili ko. Siguro this Zoom na account, yung other Zoom account, medyo mute niyo po. Kaya lang, maririnig ba nung mga nasa Zoom?
Yes, we can hear you, sir.
Yes. But I think the account named Live Breakout RM is also, the microphone is open. I can hear myself.
Sige po, Doc.
Let's try again. It's still not working. I can hear myself. Yung Live Breakout RM. Okay, now. Okay, good. I can't hear myself anymore. Thank you, salamat po. And again, no, I wish I can join you in person. I'm here in Berlin. We just finished a 3-day World Health Summit. It's an annual conference organized by the German government where leaders in the global health space convene, engage in dialogue, debate, basically about the future of the health of the world. And one of the topics that, have been really, centered in the World Health Summit, especially in the past several years, is the issue of climate change and human health. And climate change is certainly a crisis, an existential threat that we should all be addressing, that we should be, we should accelerate the action for or action on, the solutions. I wish the entire Code NGO can be in this session. I understand there's a parallel session also on climate change and livelihood. But we know that ultimately, at the end of the day, it's the health of people, the well-being of our communities and our societies, which will be impacted by this crisis. So I'm not sure if you're recording this session. I really would love everybody to be hearing this message, that our planet and our health are deeply interlinked, that the climate change, the climate crisis...
Recording in progress.
Public health. Now I'm hearing the recording in progress. I'll repeat that line. That our planet and our health are deeply interconnected, highly interlinked. The linkages between climate change and public health cannot anymore be ignored because climate change is going to affect the health of people, And we can do something to improve both the health of the climate and the planet and the health of the public. And I will be very quick with some of the introductory slides. I want us to have more time for discussion. Of course, thanks to Jake and to Pao, my colleagues, my teammates at the St. Luke's Medical Center's Planetary and Global Health Program. What we're doing is we're preparing the next generation of health professionals who care not just for people, but also for the planet. And during the past 3 years, we have learned, we realized that we live in an era where there's a lot of risks that are confronting human health. You know, COVID-19, as you can see, there's a small wave of COVID-19 there. Of course, in the past 3 years, it felt like not just a small wave. You know, there are waves of new variants of COVID-19, of SARS-CoV-2. But we should also not forget that as we speak, not only future waves, but future tsunamis of climate change and biodiversity collapse are now being generated, that are now emerging and are going to undoubtedly and certainly threaten the health of human populations. We know that climate change is a human-made problem. It's not due to the natural greenhouse effect. I know, and I hope you know what a greenhouse is that we use in agriculture. But right now we are facing a human-enhanced or human-induced greenhouse effect. The sun's heat is entering the planet, is being trapped because of that thick layer of greenhouse gases that we have been emitting to the atmosphere. That heat is trapped, not getting out of the planet, which is destabilizing the global climate system. And these are the sources of greenhouse gas emissions. I will not go into the details of these pie charts, but you will see different sectors: the industry, transport sector, the agricultural sector, the meat production industry. All of them are contributing to greenhouse gas emissions. When we say greenhouse gases, it's not just carbon dioxide, but also methane, which comes a lot from the agricultural sector, nitrous oxide as well. All of these pollutants are concentrated in the atmosphere, creating that layer that prevents the release of heat, and again, leading to the destabilization of the global climate system. And what happens when the climate system is destabilized? You can see all the different impacts on our ecological systems: changing rain and snow patterns, stronger storms, higher temperatures, and more heat waves. So it's either the wet or the dry and hot phenomena. All of these are going to be experienced in the era of climate change. Our waters are not spared because of rising sea level as a result of the melting of the ice caps, warmer oceans, which then lead to the damaging of coral reefs, which are the forests of the seas. It's where our fish, do reside, and we know that destroyed corals lead to decrease in fish harvest. We're already seeing that in many parts of the Philippines. And of course, changes also in our terrestrial ecosystems, our forests, more droughts, wildfires, so on and so forth. And it also affects animal behaviors, animal migration, animal life cycles. So all of these are the impacts on the environment. But also, we humanity, we human beings, are part of the environment. Societies are part of the environment. And therefore, societies are also going to be impacted by climate change. I'm sure you are already talking about many of these impacts. The other session is looking at impacts on livelihood. But also, there will be impacts in food and agricultural productivity. Our farmers are now facing difficult times when it comes to harvesting either rice or catching fish, in the fishery sector. Of course, we're seeing inundation, flooding of coastal areas, more typhoons, more extreme events leading to disruption, if not destruction, of human systems, food systems, school systems, hospital systems even, water systems, electricity systems. Workers, especially those that are exposed to extreme heat, are also facing or experiencing reduced productivity and capacity. And it can lead to more wars due to limited resources. Now we're having another very catastrophic, violent, atrocious conflict in the Middle East. We can see more of that in an era of a warming planet. And at the bottom, you will see that diseases are also going to be affected by high temperatures. And that leads to the main topic of our session today. How does climate change affect the health of human populations? This is a diagram that I always show, and I'll not belabor you with the details, but as you can see, there are multiple arrows, multiple boxes. Message number one, climate change will impact health in many different ways through storms, droughts, flooding, heat waves. Climate change will alter, modify the different social and environmental determinants of health, our living conditions, our environmental conditions, which then will impact the health of people in many different ways, in many different arenas. In fact, as you can see on the right, there is no single disease group that is going to be immune to the impacts of climate change. You name it, respiratory disease, cardiovascular disease, they will all be affected by air pollution and extreme heat. Infectious diseases, mosquito-borne diseases, dengue, malaria, and other waterborne diseases, cholera, typhoid, all of these are going to increase, again, because they're all sensitive to the changing climate. Nutritional status, it will be reversed in the coming years because climate change is going to affect food productivity. And now we're already facing, rising food prices and bad food policy and governance in our country. And mental health, because climate change is also affecting the health of our brains and our hearts. It's a mental health issue. It's an emotional health issue. I have another slide on that in a short bit. But it's very important to remember that climate change, yes, it's a universal issue. It's going to affect the health of the world. But not all populations will be experiencing the same impacts. Some populations will be affected more than the others. Some populations will be affected much faster than the others. And as you can see in these maps from the World Health Organization, at the top map, you will see the parts of the world that have been emitting the greatest amount of greenhouse gases into the atmosphere. North America, Europe, and more recently, China. And at the bottom, you will see the parts of the world that will be bearing the brunt, that will be suffering, that are already suffering the consequences, the health consequences of climate change. The continent of Africa, huge swaths of Asia, even the Pacific Islands are too small in this map to be magnified. So the perpetrators of the climate crisis and the victims of the climate crisis are not the same. And therefore, this is not just a public health issue, it is a climate and health justice issue. We need to be applying a strong justice and equity lens when we try or attempt to deal with the health impacts of climate change. So this is our region, Southeast Asia. Southeast Asia in general is a climate and health hotspot. But as you can see in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, the Philippines is the reddest of them all. It just tells us that we need to act, we need to speak up. The Philippine development sector, our NGOs should really be, using its voice and its energy and its collective power to address climate change, address the health impacts, and call to attention and hold accountable the world leaders, especially the global north. And we know that climate change, again, as I've mentioned, destroys every aspect of our society. This is a photo from Typhoon Haiyan, which happened in 2013. This year, we're commemorating the 10th year anniversary of Typhoon Haiyan. It seems we're not learning the lessons of that strongest typhoon to ever hit land in human history. We're repeating the same mistakes. We are not enhancing our disaster preparedness and response capacities, the resilience of our health systems. Universal healthcare still is not a reality, and climate change is going to threaten our ability to provide healthcare to people, again, in the coming years and decades. And over the past 3 years, we have experienced the confluence, the convergence between two crises. On one hand, you have the climate crisis. On the other hand, you have the COVID crisis. Imagine you're a poor Filipino living along the coastlines, living along the corridor of the typhoon, and you're confronted with the dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus, only for my house to be blown away, or for the roof of the house to be blown away by the strong wind? Or on the other hand, do I stay in these cramped evacuation sectors, safe from climate-related disaster? But as you can see in this photo, there's no physical or social distancing to begin with. And so there's a very high chance that you will be contracting the unseen coronavirus. So imagine in the future, if more pandemics will happen, climate change is going to complicate our pandemic response. We need societal responses that bring together climate resilience and pandemic resilience. And unfortunately, and as you surely will agree, there's no such thing until today in our country and even in our world. And I already alluded to this, that the planet's health is essential to preventing infectious disease, not only the mosquito-borne diseases, not only the waterborne diseases, but also future pandemics. Dengue is now, being seen in different parts of the world where they used to not be existing, including here in Europe. I've been hearing cases of dengue in Greece, in Spain, even in cold Denmark. And so the geographic spread of mosquito-borne diseases, which are tropical diseases found in the Philippines, endemic in Southeast Asia, now expanding. The spread is the geographic scale is expanding, reaching even temperate regions of the world, like Europe and North America. And I already said this, climate change is going to spark the next pandemic if we do not get our acts together now. Another virus will be jumping from an animal to a human being because of climate change, because of deforestation, because of biodiversity loss, because of continuous and irresponsible urbanization and encroachment into wildlife. And you will see in this map that the pinker or the more violet the part of the world is, the higher the risk for more zoonotic spillover. So that's the term when you see a pathogen or a microbe jumping from animals to humans. And so we are a pandemic hotspot. We are a climate hotspot. And therefore, again, the Philippines should be leading this fight against both pandemics and climate change. And it's not only the typhoons, the flooding, the infectious diseases. The Philippines is also facing the fastest rates of sea level rise in the world, around 5 times that of the global average. And you go to the coastal communities in the Philippines, you will now be seeing places where farmlands or even residential areas beginning to be inundated by sea level rise. Water is now becoming highly salinized, high in salt content. And when people drink water that is high in salt content, they experience a wide array of health impacts. This is a sampling of studies that come from Bangladesh, from Vietnam, from different parts of the world. When you drink water that is high in salt because of sea level rise, you get hypertension, you get gestational hypertension if you're a pregnant mother, you get preeclampsia, which can lead to spontaneous abortion or low birth weight of babies, or even death of babies, and many others, chronic kidney disease, kidney stones, among others. So these are just some of the impacts, and we are starting to investigate this in the coastal communities of the Philippines because this is going to happen whether we like it or not. And worst comes to worst, if we are not able to manage coastal inundation due to sea level rise, entire cities will be underwater. Manila will be underwater by 2050 if climate change isn't going to be stopped. And it will lead to forced displacement of entire populations, entire communities. We're worried about what's happening now in Gaza, when hundreds of thousands of people are being evacuated. And in an era of climate change, this is not conflict-driven displacement. This is climate-induced forced displacement of entire populations and communities. And we touch on the wet phenomena. there will also be a lot of hot and warm and dry phenomena in the Philippines. Heat indices that are beyond, our what our physiology, what our body can, survive and absorb, are now being seen, witnessed in the Philippines. You remember in May, some parts of the country reporting very high heat indices. We anticipate more of that in the coming years. Are we ready to address the health impacts of heat? Do we have the public health policies and plans and the workforce ready to treat heat-related illnesses, heat cramps, heat stroke, increasing hypertension, among others? And I already mentioned this a while ago, the nutritional status of the Philippines, the nutritional gains of the Philippines will be reversed. We still have a long way to go in achieving total nutrition security. You're seeing some of these numbers, which are not good numbers, and these numbers are likely to be worsened in the coming years. So I'll not go into the details. Nutrition is going to be a priority issue. Climate change is going to affect the nutritional status of the Filipino. We need to pay attention to this as well. And lastly, I mentioned about mental health. We're now developing this new research agenda, the nexus of climate change and mental health. We know that when a typhoon happens, intense flooding, communities, households, they become evacuated, forcibly displaced, they lose their homes, they lose their property, they lose their livelihood. It can then lead to what we call post-traumatic stress. Some are acute, some are more long-term. But also now what we're observing is that you don't even need to experience disaster firsthand in order for your mental health to be affected by climate change. And that is the emerging concept of climate anxiety or eco-anxiety. I'm sure, colleagues are working in the climate space. I myself am experiencing some levels of climate anxiety, feeling anxious, feeling frustrated, feeling hopeless, about the future. And in fact, in a 10-country study that was published in 2021, it showed that of the 10 countries, it's the Philippines, the Filipino young people are viewed as the most climate anxious in the world. Around 90% of the respondents said that they are moderately to extremely anxious, afraid, frustrated about their climate unstable future. So this is very important, that we need to address the physical health needs of communities. We also need to take care of mental and emotional health needs of our people. The sad thing is that, I'm sure you're aware of the Paris Agreement, which said that countries will need to keep the global average temperature increase to below 1.5 degrees Celsius. That is what we want in order for the Pacific Islands to not be totally erased from the face of the earth. But the scientists recently said, based on findings, based on research, that we probably have overestimated. We actually don't have until 2030 to achieve the Paris goals, because given our pace of action, given the trajectory of the world in terms of lowering carbon emissions, greenhouse gas emissions, we are likely to breach the 1.5 degrees Celsius, not in 2030, but in 2027, 3 years much earlier than earlier predicted. So this is really a call for a deep sense of urgency. This should be a cause for alarm, not only for us health professionals, but for the entire development sector. We should be panicking. We should be afraid. We should be acting fast. And Greta Thunberg, the Swedish activist, young activist, said we should be acting as if our house is on fire. And our house is on fire already, literally, in some parts of the world. So the question that we should be asking is, are we ready to build health systems that consider the climate? Are we ready to train the next generation of health professionals who care not just for people, but also the planet? And that's what we're doing in St. Luke's, as I mentioned a while ago. Are we ready to really rally around, climate and health and speak about climate change as a health emergency, Because COVID-19 was a dress rehearsal. It already showed to us we're not ready for COVID. We certainly are not ready for climate. And we know in climate change, when in the climate discourse, we always talk about two functions, two buckets of things and activities that we need to do. We need to do mitigation. We need to reduce our carbon emissions, our greenhouse gas emissions, the sources that I showed to you a while ago in the pie charts, through green transport, clean energy, energy efficiency, so on and so forth. But we also need to do adaptation, especially when you hear that kind of news that we're about to breach 1.5 degrees Celsius in 3 years. We know the impacts are going to happen. We know that some impacts are inevitable, are inescapable, and therefore we need better disaster response. We need flood protection. We need infrastructure upgrades. We need strong health systems that bend but do not break. And that is what the concept of climate smart healthcare is about. It's bringing together mitigation and adaptation, bringing together sustainability and resilience. We want our health systems to be doing no harm to the planet. Remember, we doctors made an oath to do no harm to patients. We must also do no harm to the planet. And we also need a health system that is resilient, that, as I mentioned a while ago, bends without breaking, that can adapt and that can continue providing care to people, even in the face of climate-related shocks and stresses, the catastrophic impacts and the long-term, more subtle changes, like disease emergence, for example. And so this is just to illustrate to you that the health sector is also burning its and releasing its own carbon emissions, greenhouse gas emissions. I'm not going to the details. I'm not sure how many in the room are from the health sector, but you will see that in every aspect of healthcare, whether it's the electricity that you use or the medical devices that you purchase, the pharmaceuticals, the medicines that you purchase, everything is contributing to climate change through carbon emissions. Okay, another illustration showing to you that healthcare is emitting carbon. There was actually a paper from the international NGO Healthcare Without Harm that revealed that healthcare, the global healthcare system, is emitting around 5% of the total greenhouse gas emissions of the world. Significant, not as big as the other sectors, but still significant. And I think we need to internalize the leadership role of the health sector, leadership by example. If the health sector can do it, other sectors can do it. And we've seen that during COVID. We've been leading the world in trying to protect people from the virus. And we should be leading the world in trying to address the climate crisis as well. That is what we're talking about here in Berlin at the World Health Summit. And I invite you to take a look at this framework from Healthcare Without Harm, the Global Green and Healthy Hospitals Program. There are at least 10 things that we can do within the health sector, within health facilities, within hospitals, in order to do no harm to the planet. And I'll not read them all. As you can see, food, energy, chemical management, water, purchasing, etc. These are all arenas for action. And then, this is just a collection of photos. What I usually do when I go around the country is to take photos of hospitals that are already embracing solar power, sustainable practices and technology. And these are just some examples of hospitals that are already starting to walk the talk. And then I already mentioned climate resilient health systems. So one is we need to make our hospitals green and healthy. And the other one is we need to make our hospitals, health facilities, our local health systems, our LGUs, climate resilient. And when we say it's resilient, they do not collapse. A health system does not collapse, but instead it recovers and recovers better than before and even transforms in the face of climate-related shocks, like a typhoon, or a climate-related stress, like, for example, an increase in dengue or increase in undernutrition. So, for example, this is a framework from the World Health Organization on how to build climate-resilient health systems. I'll not go into the details, but as you can see, We can train the health workforce. We can address governance issues. We can ensure that there's ready financing for climate and health initiatives, so on and so forth. Please take a look at this framework from the WHO. And again, I already mentioned we need to do better in terms of preparedness, the entire disaster cycle, the way we prepare, the way we reduce the risks, the way we respond, provide relief, and ultimately recovery and reconstruction. And I mentioned Haiyan a while ago. I think there's some parts of Tacloban that are still not fully recovered 10 years after the calamity. And we need to do better. We need to recover better. We need to recover and make sure that, in the future, we do not succumb to such, calamities again. And so these are just some pictures of what we're doing in St. Luke's. We are working with 2 coastal communities now in Iloilo and in, Quezon. And we are, innovating, pioneering, piloting, testing some tools, some methodologies on how to build the climate resilience of local health systems, because local health systems are in the front lines. When a calamity happens, communities don't go to national government first, they go to the local health system. And it's very important, and it's imperative that our local health systems do have these resources and the resilience to be able to address these challenges. We need to start using climate data in order to make better health decisions and plans. So for example, I invite you to use Hazard Hunter, which is an app or a website developed by the Department of Science and Technology. And I did it for my hometown. I live in Calamba, Laguna, the hometown of our national hero. And if you actually project for example, future flooding in our hometown, you will see that a lot of our health facilities are actually going to be underwater. And so it's very important that we now incorporate climate change into health planning. And this is another framework from the WHO telling you on how to make sure that our health facilities, our hospitals, our clinics, our rural health units are both climate resilient, and that's the adaptation function, and environmentally sustainable, and that's mitigation, not harming the planet, the environment as well. And ultimately, yes, we need to do a lot of things within the health sector, within the health system, within our health facilities. But we also need to improve health and protect the climate through action across sectors. And I understand that Code NGO represents a wide variety of development arenas. And we need to work together, urban planners, the energy sector, the transport sector, the industry, the healthcare sector, the agriculture and forestry sector, the governance and peace sector, gender, based organizations, among others. We should all work together towards a healthy people and a healthy planet. So I'm going to wrap up now. The climate change emergency, or the climate emergency, is a global public health emergency. That should be the message that we should be telling. And this is not a message only for doctors like myself or health professionals in general. Everybody should now be using this language, should now be telling this story, should now be looking at climate change, not just as an issue about polar bears getting dehydrated. It's also about human lives and people's health. And right now, as a physician, I always tell and remind my students in St. Luke's that we now have 2 patients. You have that kid wearing a face mask, trying to protect herself from the unseen coronavirus. And you also have Mother Earth also wearing a face mask. Of course, not trying to be protected from the pandemic. It can survive the pandemic, but instead to be safeguarded from the myriad ecological damages, such as climate change, that we are inflicting on her as a result of our irresponsible human activities and decisions. And that's why I invite all of you. You've heard that, in St. Luke's, we established the Planetary Health Program. We're not anymore just talking about public health, because public health is unfortunately only about the health of people. We now have to have a much more holistic view, because we now have two patients, not just the people, but also the planet. And that is what the planetary health message is about. So thank you again for this opportunity. Together, let's advance the health of both people and the planet. Thank you, congratulations, and I look forward to our conversation.
Okay, thank you so much, Dr. Renzo. Of course, it's no surprise. Ilang beses ko na po narinig tong talk ni Dr. Renzo. However, with each and every run, palaging marami po ako natututunang bago. So, thank you so much, Dr. Renzo, for your time. And now that we are more settled in, I'd like to reintroduce myself. Of course, here is our inaugural director, Dr. Renzo. I'm Jake, and this is Pau, and we are again from the St. Luke's Planetary and Global Health Program. We are one of the first, if not the first, academic institution that's really dedicated to researching and innovating planetary and global health here in our country. And if there's a few things that really define our organization, it's that we are really interactive and we are action-oriented. And the message is clear after the lecturette of Dr. Renzo. And the message is that our health is dependent on the health of our planet. Kanina po buong umaga, I was hearing a lot of very wonderful speakers, and I was both amazed and overwhelmed with the wealth of interdisciplinary knowledge and concerns about climate and climate change. We have been talking about social, commercial, economic development, but let's turn to health this time. Something that is more personal. We have been talking about capacitating communities, adapting and mitigating climate change. But this time, let's also consider, at the end of the day, uuwi po tayo in our homes, and climate change has a direct effect on our personal health and the health of our families. Like we said, dalawa na po ang pasyente natin. It's not just us, planet, and our planet is sick. And so will we if we don't take action. Now, after all of that intro, I'll be asking for everyone's help as we foster this collaboration. We'd like to conduct some sort of a synthesis and a call to action, because we understand that climate change and health is actually a wicked problem and is an emergency. So may I please invite everyone to please have their mobile gadgets ready. We'll be having just 2 Mentimeter sessions, and the first question for our Mentimeter, if you need help, please raise your hand. We can assist you in this regard. You can either scan the QR code, or you can actually visit Mentimeter and enter the code 68579093. And this is not just for our roomers, but also for our Zoomers. Sabi nga kanina, may natutunan na naman ako today. That's very cool. So we have the roomers and we have the Zoomers. Okay? We'll give you a few seconds po to join us.
So if anyone needs help, please just raise your hand.
Okay? Sige po. We'll be starting with the first Mentimeter question. What health impacts of climate change should be prioritized here in our country? Let me read that again. What health impacts of climate change should be prioritized in the Philippines? Like I mentioned, buong araw pinag-usapan natin social and economic development. This time, let's focus our attention to health. And you might share either a personal experience, your personal insight, But what do you think are the health impacts of climate change that should be prioritized in our country?
There are no right or wrong answers. Again, this could be really subjective because it can be based on your personal experiences. So go ahead and key them in.
Yeah. So we have 9 Mentimeter participants. And you can type in as much as, I think, 3 responses. If you could limit to 1 or 2 words, that would be great. So ano po kaya yung health impacts, no, ng climate change that should be prioritized? Okay.
And so we're starting to see answers.
Wow, I like it, ah. In the middle of our word cloud, we have mental health. And then we also have cancer and stroke.
We also have physical health in the mix.
We also have PTSD from disaster, respiratory and outbreaks, food insecurity. Keep them coming.
So we have climate-related diseases, yes. Outbreaks also. Ngayon ata ang pinaka nag-outbreak is dengue. So before it used to be one-time thing in a year, pero ngayon all year round na ang dengue. So we see how different sectors actually are working towards combating this.
And I can see here outbreaks as well. Actually, there is literature supporting, no, the evidence that COVID-19 might actually be related to climate change because it's a vector-borne disease, no? There's animal transmission, no, and that was because of climate change. Okay, I think yan na yung responses natin. So, first of all, we're really happy to see that it's not just about physical health, not just about heat-related diseases, but also mental health, as well as the social determinants of health. Pao, anything you'd like to add?
So I would just add yung about PTSD from disaster. So I just recently came from Iloilo actually. So if you remember, they were hardly hit by Agaton and Haiyan or Yolanda. And when we asked them, we were very careful kasi alam namin it's an emotional experience. Ang sabi nila namin, ay ma'am, ayaw na naming balikan at ayaw na naming maulit. So really that's where we see how big the impact was and is actually currently still happening to them.
And before I turn back the mic to Dr. Renzo, no, perhaps what really summarizes all of your responses is that this is still clearly reflective of the triple burden of disease here in our country. We're talking about infectious diseases, such as disease outbreaks, COVID-19, dengue. We're also talking about non-communicable diseases, such as cancer and stroke. And then lastly, diseases brought about by globalization and urbanization, such as mental health and even the broader social determinants of health. Dr. Renzo, I hope you're still online. Anything you'd like to add before we move on to our next Mentimeter question?
Sure. Well, thank you very much for your answers. No, I appreciate that there are 26 colleagues here who are really deeply engaged. No, and I think I gave extra emphasis on mental health, and that's why it showed up. But also, I think it's really a reflection that right now we Filipinos are, one, realizing that health is more than the physical. But number two, I think with all the challenges that we're facing, and it's not just climate change that is creating mental stress. Social media is a very stressful space. The misinformation, the vitriol, the hatred, our political and economic situation is also very stressful as well. And all of these are interacting. The environmental, the political, the cultural, the climate, the economic, all these stressors are really happening at the same time and making us more mentally and emotionally, distressed, sad, angry, etc., anxious. And maybe that's something that maybe we can explore working together on. Last week, of course, was World Mental Health Day, and Liana was there in our event. How I wish we all invited you also in that event. But we're just starting, in terms of addressing the mental health impacts, not only of climate change, but the mental health challenges that are experienced by the Filipino people. And then, of course, I'm seeing other diseases, and I also want to, give an appreciation. One, there's a specific mention of women's health. We know that some populations are going to be more vulnerable to the impacts of climate change. Women, for example. And right now, our team, myself, we're working with the obstetricians and the gynecologists, the women's health doctors, because climate change has impacts on women's health that are, unique, that men will not experience. The impacts on their reproductive and sexual health, the impacts on their mental health as well. The potential increase in gender-based violence as a result of disasters. We're already seeing that in evacuation centers time and time again. And I also want to appreciate the answer. There are two answers that mention the word indigenous. And maybe, I would love this to be a conversation. I would like to hear from some of the participants in the room or the Zoom, the roomies and the Zoomies, or the Zoomers, to, share some thoughts on, the role of indigenous knowledge systems and practices in addressing the climate and health nexus. In fact, I'm part of an international initiative and we're really looking into this. So happy to hear your thoughts, but also how climate change can disproportionately affect the health of indigenous Filipinos. They're already marginalized in the health system, and climate change is going to exacerbate that marginalization in terms of healthcare access and in terms of achieving health equity overall. So happy to hear thoughts from the participants. Let's turn this into a reciprocal and multidirectional conversation. Thank you.
Okay, thank you so much, Dr. Renzo. And probably corollary to that, actually na-mention po ng speaker natin kanina, one of the solutions to climate change is actually land relocation. Although that might be effective, can you also imagine yung idea of giving up your homeland? That actually has a very big impact in one's mental health. And as mentioned by Dr. Renzo, since this is a conversation, anyone from the audience who would like to share their thoughts po before we proceed to our final Mentimeter question? Yes, sir. Thank you.
So I would just like to thank for bringing up this planetary health, because we have already elevated it is a planetary crisis, so the response is planetary health. And there have been literature actually that correlate health and climate change. The impact of climate change to health is interrelated, and at least it is now discussed mainstream. So when I speak about indigenous education with climate change and health, by the way, I am Xerxes Solon from Ormoc City, Aguila. Our organization is Aguila, Active Genuine Youth Leaders Association, a network of IVNET, and a member of Code NGO. So, because in the indigenous knowledge, environment for them is spiritual. It is their health. So, in our locality, in Ormoc City, we have the Lake Danao. It is a protected area. It is a protected area, and the people there, they know, because they have the Rizalista, that not a cult to Aguila, but they're not indigenous. They are just people living there since we could remember, in the middle of the forest. And they have been there protecting the environment. So they wake up at the rise of the sun, they wake up, and then when the sun will set, they would also sleep. So as simple as that. So I say that as a planetary health. But my question is, how are we going to position planetary health in the conference of parties in climate convention internationally? Because I'm also involved in the Philippine movement for climate justice, and our strong battle cry is for the demand of payment or for the reparation. Because a demand from the European countries, because they are a major contributor of carbon emission, and thereby, so we already know that. So, and then we are the victims or survival, as we may say. So our advocacy has been gaining trust that the European countries seems to talk about that, according to our consultant. So my question is, how are we going to position planetary health in the conference of parties in the international to make it as a policy engagement? Thank you.
Wow, favorite word nga kanina, very sharp questions po, no? Sir, to tell you honestly, there's no straight or simple answer to that. But what I can assure you is that in discussions of planetary health, the two frequently cited values are always equity and social justice. Because we do understand that those who are most vulnerable, no, are actually the victims of the greenhouse emissions and other man-made problems, no? And that's not fair. That's simply not fair. That's not acceptable. Probably to give us more insight to that, Dr. Renzo, any response to that?
Yeah. Sure. Well, maraming salamat po sa napakagandang tanong at sa shinare po ni Sir, no? You know, where do I begin? I like what you said, Jake, that equity and justice are really central to the planetary health concept. And not just justice in terms of, you know, justice and fairness and equality between nations and between communities. We're also talking about intergenerational justice and responsibility and equity. You know, I always tell my students in St. Luke's, or, you know, any student around the world that I have, that we need to, you know, think about the generations that are yet to be born, yung di pa napapanganak. And do we want to be judged by them as being good ancestors or bad ancestors, no? And of course, we want to be good ancestors. We want them to think that we made the right decisions, not just for ourselves, but also for them. And so justice transcends not only geographies, but generations. And that is central to the planetary health message. You mentioned about COP28, and I'm going to COP28 in Dubai. This COP28 is exciting for us in the health sector. There will be the first ever World Health Day in COP28. Usually health is just a side thing. Now it's going to be central. And you know, I think, and I encourage, you know, our friends from the climate sector, you know, I'm a friend of the PMCJ. I think we need to bring in more of the health message into climate advocacy, into our climate messaging, because now we're realizing it's very powerful. It speaks to the heart of decision makers and politicians. You know, if you tell them that the health of their children and their grandchildren are going to be affected, then they begin, you know, they start taking this issue much more seriously. And, you know, and as I've said, you know, we will be there, health professionals talking to climate negotiators about the message of planetary health. And regarding indigenous health systems, you know, you mentioned spirituality, which is a vital component of holistic health. In St. Luke's, in the Planetary and Global Health Program, we believe in a much more holistic definition of health. And it's interesting because I was just talking to a colleague an hour ago, and we are, you know, brainstorming about establishing an initiative around the intersection between faith, spirituality, and physical and mental well-being, mental wellness. You know, how can we you know, use the power of religion, of faith? And when we say religion, it's not only Catholic religion, indigenous religions and faiths and practices. How are they contributing to the improvement of our health, you know, both physical and mental, but also the health of the planet? Because again, indigenous practices from around the world, indigenous food systems, indigenous ways of protecting nature, biodiversity conservation, these must be centered in our you know, collection of solutions. And that means we need more indigenous voices to be sitting around the table. So thank you for your work. Thank you for your question. And hopefully let's work together in advancing this area. Thank you.
Thank you so much, Dr. Renzo. And Sir Circes, just to add, you were asking about policy making. To tell you honestly, Here in the Philippines, it's quite a very young topic at the moment. Is that just recently, we were actually invited by the DOH to talk about health policy and systems research. During that forum, ito po yung mga napag-uusapan. How do we include planetary and global health into the health agenda and to the other policies that we would like to formulate in the future? Because the answer is, it's really, really difficult. It's really, really complicated. So I hope you can join us in that future action. Pao, something you'd like to share?
So we just have a comment from one of our viewers online. So this is from Surrey. In the Yolanda experience, the local health system collapsed. The first health responders were mostly foreign medical groups and from international NGOs. So he hopes that local medical groups in the Philippines be now the first to arrive at ground zero within the first 24 hours during extreme disasters. So I believe this is a reflection of how much work still needs to be done by the Philippines. And I think yung recognition that climate change is happening and that thing about it is really blossoming. And kaya we're very thankful for these kinds of opportunities to share the floor and to co-create with different sectors because again, this needs an intersect collaboration for it to work.
Okay, so thank you so much for that. We're moving on to our final Mentimeter question. Like I mentioned, we are not just only interactive, but more importantly, we are action-oriented. And at the end of this day, no, marami tayong natutunan ngayong araw na to. The question is, what are the things that we can commit? What do we do now? What do we do starting tomorrow? And we would like to ask the audience, our room and our Zoomers this question, what are cross-sectoral solutions to climate change and health? To tell you honestly, we really cannot do it alone. The health sector cannot do it alone. And in the broader sense of the social determinants of health, there really needs to be a cross-sectoral collaboration. So we'd like to know from you guys, you are the experts here, you represent different sectors. How can we address climate change and mental health? So I hope you can start sharing on our Mentimeter and wow, may mga excited. Meron na tayong
May
mga
answers
responses, no? We have food security, we have political engagement, and like I said, we really need collaboration.
We also have economic development and strengthening public health. Yeah, so these systems should not only exist, they should be enhanced and really work together no, to make a change.
Yeah, and I can see new entry, we have capacity building. I guess na-establish natin kanina no, during our morning session na all the different NGOs and all the different sectors at our different levels of understanding as to how we're going to address climate change. And we really need to build our capacity. Empowerment is also there, part of which is capacity building, a more inclusive approach. Sabi nga po kanina, no, that was really eye-opening for me that climate change is actually a gender equity issue. I never thought about it that way. So that's new learning for me. And then people participation, no? I think ang na-establish natin kanina, the solutions that we're putting forward can only be sustainable if we really involve the communities, no? That they take ownership of all of these things that we're doing. Anything you'd like to add, Pao?
So I think pag pinagsama-sama po ang lahat ng ito, no, that would define what cross-sectoral solutions are. Yan.
Yeah, natamaan ako dun sa include in med school education. As a faculty of the College of Medicine, most definitely this will be a priority moving forward. Yeah, so I guess I'm really, really happy to see collaboration in the middle. Since this is very, perhaps a new concept, no, to some of us, there really needs to be more capacity building pa for us to really come up with issues and solutions, I mean, to climate change and health. But Doc Renzo, we're interested to know, what do you think would be the priority cross-sectoral solutions to climate change and health? Or do we have ongoing projects at the moment?
Yeah, thank you very much, Jake and Pao. And again, thanks also to all your answers. I guess my top of mind feedback is that, maybe this is something that is quite new and just sinking in, because you just learned about the intersection between climate change and health 30 minutes ago. And so what I'm seeing now is more, I guess, the principles, right? We need rights-based approach, inclusive approach, collaboration. We need to build capacity. We need to empower. We need people's participation, etc. So these are all really important ingredients for those cross-sectoral actions that we need. Maybe the level 2 exercise later on, not in this conference, but maybe later on, we need to start identifying very concrete cross-sectoral solutions. And there are some initial answers here. Maybe there's something around food that we can do, right? Making sure that the food system of the Philippines, it's both economically secure, but also climate friendly, also climate resilient, and also nutritious and healthy. Because we can't just be producing food that is, climate friendly, but then they're making us fat or giving us hypertension. So these are really important, I guess, tensions or considerations that need to be taken into account altogether. And they can only be achieved if different sectors and disciplines are inside the same room, working together, having a conversation. If it's just us doctors, we probably will only focus on nutrition and health. And we probably will not care about the planet. Although, as you are hearing, we have doctors like Jake and Pao and myself who are now looking at the intersection between the planet's health and the people's health. I saw another comment on, where is that? Economic development, of course, poverty, alleviation and eradication eventually are central, to improving the climate, improving the health of the people. And that will require a range of, policies from, social safety nets, for example, social welfare, all the way to redistributive policies, more a fairer taxation and transfer of resources from the rich elite or to the masses, to the poor, and that requires structural change. And yan pong pinaglalaban natin marami sa development sector, and we want to make sure we're not just doing dole outs and putting band-aids, but really addressing the systematic root causes of inequality, of the asymmetries in the distribution of power and resources in our society. And then gender sensitivity, I appreciate you, Jake, saying, and as you know, Jake and Pao, the Planetary Global Health Program pushes for gender equity in healthcare, in public health. I always say we cannot have manels, which are all male panels. We should be having conversations across, the entire spectrum. And adding a gender lens to our work is so critical, because we already talk about the inherent, not inherent, the specific vulnerabilities of women and the LGBT community, for example, to climate impacts. But also we need an intersectional lens, because it's not just the LGBT and the women and the non-gender conforming communities that are affected disproportionately, but also the elderly, the indigenous communities, people of color, people with disabilities, children, people with different political ideologies. Right now, environmental defenders are an endangered species, and we have one project looking at the mental health of environmental defenders. So these are like really some initial solutions, and I hope that we will continue to have these conversations. Maybe there should be another full-day workshop, and I'll make sure I'll be with you in person, so we can really find the solutions at the nexus, at the intersection. Because again, as you've said, Jake, we cannot do this alone. The health sector can't do it alone. The development sector cannot do it alone. It's an invitation for us to do transdisciplinary and cross-sectoral collaboration, to think out of the box, innovative, but at the same time grounded in the principles of equity and justice. So yeah, those are just some of my comments, and I want to hear more from our colleagues in the room. No, again, this is just the beginning. These are some of the ingredients, some of the high-level ideas. Hopefully, moving forward, we can really identify concrete policy solutions, concrete actions for the community, with the community, because the community is not a guinea pig. They're not beneficiaries. They should be seen as real partners in this work.
Of it, we really need to collaborate, and we can start collaborating by having these conversations. Anyone po from the room or from Zoom would like to share their insights, additional comments or feedback?
And gusto ko lang i-echo yung sinabi ni Doc Renzo, no? So we have very important points, pero yung pag-recognize sa community not as beneficiaries but as partners. So that's a very important point that I believe the development sector also strongly shares with us, no? Ayan. So if anyone else wants to say anything or emphasize anything.
I can add, no? Hello, can you hear me?
Yes, Doc. Go ahead.
Okay. Yeah. And what I forgot to mention, because I think one of the questions also was, are there concrete examples? And right now, as I mentioned, we're working with 2 coastal municipalities, and our entry point is health. But actually, all our meetings, all our conversations, all our co-diagnostic workshops, and the planning and the co-incubation of solutions, they are attended, participated in by colleagues from different sectors: nutrition, agriculture, disaster risk reduction, peace and order, etc. So, and health can be a powerful entry point. But at the end of the day, every discipline and every sector should be represented around the table.
Insight lang doon sa sinabi ni Doc Renzo, no? One of the activities that we're doing is we're actually helping LGUs to harmonize their local investment plans for health as well as their local investment plan for climate, because it seems na hindi pala nag-uusap yung dalawang investment plans. So that's a step forward. So I guess we really had a very productive day today. So we would like to thank everyone, both from this room and from Zoom. And at the end of the day, I'd like just to highlight that health should be integrated in all of our social, economical, developmental policies and activities, because at the end of the day, it doesn't just affect the environment, it affects your homes and it affects you. So with that, thank you so much. Perhaps we can wrap up the session with a photo opportunity. Can we please have on screen po Dr. Renzo as well as probably the Mentimeter slide, just to highlight our commitments for today?
Right. And again, thank you so much, Code NGO, for this wonderful opportunity. I'm really glad we made this happen. I mean, we just had this conversation, I think 2 weeks ago, but thanks to the gift of digital technology, we can turn this into a hybrid event. I really hope that this is just the beginning of a long-term collaboration for healthy people and healthy planet. Salamat po, congratulations, and hope to meet you in person soon.
Thank you so much, Dr. Renzo, Dr. Jake, Dr. Pauline. Dr. Renzo, don't go yet. We actually want to offer our certificate of appreciation po virtually. So sana makita po ninyo if the camera can show it to Doc Renzo. I will pass on the mic to Miss MC, one of our trustees, to read out the certificate for you.
Hello, this is a certificate of appreciation is awarded to Dr. Ramon Lorenzo Luis R. Guinto, PhD, of St. Luke's Medical Center, College of Medicine, for the great contribution of knowledge during the hybrid learning session, Our Planet, Our Health, the links between climate change and public health, co-organized by the Caucus of Development NGO Networks, held on October 18, 2023 at the Oracle Hotel and Residences, Quezon City, and via Zoom. Signed, Sandino Soliman, Executive Director, Code NGO.
Thank you so
Palakpakan
much.
natin.
Thank you so much. And bigyan nyo rin si Jake and si Pao ng certificate for their great job in
Wag po kayong
moderating
mag-alala,
this,
sir.
hybrid workshop. And again, thank you at sana'y magkita
Ipakita
tayo in the near
Tayo ba?
future. Salamat po.
Meron din po, pero ito ay nakapangalan sa St. Luke's Medical Center, College of Medicine, Planetary and Global Health Program. Okay? So
Thank you
maraming
so
salamat
much.
po. Tapos, Dr. Guinto, dahil ikaw ay abroad, hindi ako sigurado kung aabot pa sa iyo ito. Pakita nga natin.
No, aabot yan kasi I'm based there. I'm just here for a meeting.
Okay, sige. So, meron din po kaming mga token. Can our colleagues here receive it? Iabot na natin sa ating mga kasama dito, si Pau at si Jake. Yan.
Salamat po. And
Tapos kayo na rin, kunyari, tigisa kayo. O yan.
And I hope we can hear more feedback from the participants. No, we look forward. We want to improve further. The workshops that we deliver. Thanks.
Thank you, thank you. Sige po, I will just ask our members, fellow trustees to join us here, Doc, para we can have some kind of a virtual photo ops. Hybrid photo ops.
Yung iba doon.
Doc Renzo, pa-smile din po. Nandun din kaya. 1, 2, 3. Okay. Okay na. Sige, thank you so much again, everyone.
Thank
Doc
you.
Renzo. Thank you, St. Luke's. San si ano? Doc Renzo, thank you so much po. Ingat po
Salamat
sila.
po.
And thank you everyone who joined us in Zoom po. Sige everyone, we can move downstairs for the snacks and plenary session. Thank you so much.
Thank you. Oh my God, saan makapagpahinga? Baka naman sa picture namin.
O sige po. Sige po. Wait lang. Miss? Paano ba to?
Yan experience sa